Hi, welcome everybody to Your Health Matter OC with Dr. Chow and Dr. CK. Tonight the topic is men's physical and mental health. If you have any question for our guests, please send us an email to yourhealthmatters@ochca.com. Again, that email address is yourhealthmatters@ochca.com. Our guest for tonight on this very topic is Dr. Edwin Kwon and Mr. David Boyajian. So I hope I said that okay.
Yes.
Did not butcher your name. Dr. Kwon came to us as an assistant clinical professor of family medicine at UCI School of Medicine. And David is our behavioral health clinician in our mental health and recovery services. So thank you so much for joining us. But before we talk to our guests, Dr. CK, you want to give us an update on the COVID situation here in Orange County?
Yes. Unfortunately, just like last week, our numbers continue to rise. Our case rates are now at 25.8 per 100,000. And again, this is a gross underestimate of what's really going on in the community because this just reflects the PCR positive results that come to us. We know many of you are testing at home and likely are testing with your antigen kit. So please, if you are positive, stay home. Also contact your healthcare provider to be considered for treatment options. Also, our case positivity has increased to 11.1%, and 188 individuals in our county are hospitalized with COVID, with 20 in the ICU. So our hospitalization numbers are gradually increasing, but they're not so high that we need to do anything more. I know I keep getting a lot of questions about mandates. Everybody really just needs to be careful and cautious and layer up on many different preventive measures to keep yourself safe and your loved ones safe. In terms of our vaccination rates, we are slowly getting up there with our 12 to 17-year-olds now 68% fully vaccinated, and for our 5 to 11-year-olds, we're still in the 34th percentile for those fully vaccinated. So again, parents, if you have any questions, please contact your pediatrician or primary care provider to get your questions answered. The good news is that we may have a vaccine ready for those under 5, but that's pending the FDA meetings as well as CDC committee recommendations. And again, as a reminder, if you develop any COVID-like symptoms or you test positive at home, please isolate at home, contact your clinician, notify your close contacts that you have COVID so that they can also start monitoring for their symptoms. The recommendation is that you self-isolate for a full 10 days. However, this can be shortened if your symptoms are improving and you test negative after day 5 with an antigen test. We also do realize that some people are actually getting treated with Paxlovid, which is great. It's an oral antiviral medication that is more widely accessible. You just take the medication for 5 days. It does cause a little bit of a metallic taste in your mouth, and you do have to be assessed for your kidney function to be considered. But that being said, it's a great medication because it can get your symptoms to reduce much quicker. What we're seeing though is, and what we're hearing is that there are some rebounds. So you do have to talk to your healthcare provider, and if you pop positive again, please re-isolate so you're not infecting others.
It is important that you really need to talk to your primary care physician if you test positive and you have symptoms, right? Because they're the one would be able to write you a prescription for you to get the medication. So I think we are now sounding like a broken record,
Yes.
right?
Yes.
So if you've been exposed, get tested. If you tested positive, make sure you stay home for 5 days until you test again when you're negative, but continue to wear your mask for 10 days at least,
Right.
okay? And then if you're symptomatic, obviously, if you're folks who have other chronic health conditions, talk to your primary care physician to get a prescription for these antiviral medication because they are helping you to really stop the progression of the disease as well as prevent you to get hospitalized. So that's the goal, is to get people quickly recover as quickly as possible, and we have solution. But the other important things, and you hear me talk about this over and over again, the only way we can get out of this pandemic is really getting people vaccinated. So it is good news that our children under the age of 5 will be able to get vaccinated. Again, that is the parent and physician conversation. I would encourage you to talk to your pediatrician so that you are able to make the appropriate decision for your own child, right? That is very, very important. Yes, children are less likely to be symptomatic when they get infected, but one of the things that we worry about the most is long COVID syndrome, right? So these would have a tremendous effect on their ability to concentrate, to study, and we now know that it also affects their mental health as well, right? So parents of children of all age, if you still have not decided to get your child vaccinated, have a conversation with your pediatrician so that you can make the right decision for your own child. Okay?
Thank you.
So thank you for that update. So let's turn to our guest speaker tonight. Gentlemen, thank you so much for joining us tonight. Obviously, the topic tonight is about mental health and physical health. And what I like to do, the two of us like to do, is ask you to walk us through some of the more apparent conditions that the human man faces, right, from young to older age, let's put it that way. But one of the questions we have received from the audience before the show is, from a healthcare perspective, how do you define men? Dr. Kron, as a primary care physician.
Quite a question. So from a healthcare perspective, I think that when I'm talking about a man, we're talking about biological men with humans with an X and Y chromosome. I certainly can appreciate that this question might have, might be a question that says, what do you consider a man in terms of gender? And gender is certainly on a spectrum. It could be a social construct. Some will identify as women, some identify as men, and regardless of their biological assigned sex. But right now, as I speak, I think in general, I'm speaking more in terms of men who are assigned male sex at birth.
Okay. Would you agree, David, from a mental health perspective?
Yes, I would completely agree, yes.
So let's ask our female physician, when you see your patient, would you agree with Dr. Kwan and David?
I think this is where there's nuances, right? Because everybody has their preference on how they want to be labeled, I guess you could say. Sometimes some patients want to say, even though physically they may not look male, they may mentally feel like they're male. And they just haven't had the opportunity to have, maybe they wanted a sex change and they just haven't had that opportunity. So I think it's more respecting the patient on an individual basis and understanding where they're coming from. And when I talk about male, usually if we're talking about biologic, it's where are you physically at biologically, so I can think about all the cancer or any other health things that I need to think about to prevent illness or injury. So that's also what I talk about. But again, from more of a social entity, we want to try to ask the patient how they want to be referred to as.
So one of the things thank you so much for that. Yeah. One of the things that most parents deal with young boys, and usually when they're young, so some of the things that we talk about is injury, right? Boys tend to be much more active,
yeah.
Yes. And I apologize that I'm stereotyping, but that's what society expects a gender male boys to be much more active, rougher than our girls, and so therefore they are more prone to physical injury, right? Is that correct? Is that what you see when you talk to parents who are stressed out because of their young boy too active, or you see parents come in and talk about their young boy and their injury? And if that's the case, can you share a bit about injury preventions? What do parents have to pay attention to?
Well, I would just say from a mental health perspective, boys are almost overwhelmingly overdiagnosed with ADHD, for instance. And part of that is because oftentimes boys tend to be, typically are more hyperactive, right? So I think from a mental health perspective, I always see this as making sure they have enough time outside to play and getting their energy out. And that helps them emotionally regulate. That helps them to be less aggressive when they're told to sit still in a classroom, right? So, I think in terms of schooling, I know that PE sometimes is being slashed from certain programs in certain parts of the country potentially. And that, from a mental health perspective, is a scary thing, because we want to be able to make sure that kids are able to, especially boys, are able to get out their energy in healthy ways and not be ostracized or looked down upon by the teacher for maybe having a harder time paying attention in class. So I would just start with saying that.
Dr. Kwan, if you got a parent, I know you're not a pediatrician, but you got a parent who come to you and they worry about their young boy, what do you see?
Yeah, well, I have a young boy of my own. He's 2 years old, and
there we go.
We should probably put him in a helmet and just leave him in it. So I think that the statistics do bear out. I think that boys are certainly more prone to injury, and I think that whether they're playing sports and just kind of pushing themselves beyond what they should be pushing themselves with, or feeling an injury but just ignoring it and just playing. I think you see this a lot in driving, right? I mean, I think the highest risk group in terms of car accidents and motor vehicle accident fatalities, it's going to be teenage boys. And when they're with other boys, they're even at higher risk. When they're with other boys, I think that they have the lowest rate of actually using seatbelts, perhaps using substances while driving, speeding, racing. It reminds me of myself, honestly, when I was in high school, and I'm grateful that I have all limbs and that I'm here. But certainly, I think that there are risky behaviors that in general boys seem to be more prone to. So yeah, I mean, I think that starting from a young age, I'd say if they're not in a helmet just running around, at least when they're riding a bike or learning to scooter or something, wear a helmet. I think about my boy, and he wants to jump in the pool, but he doesn't know how to swim. And so I think that if we're talking about injury prevention, things that come to mind for children have to do with drowning, poisoning, suffocation, motor vehicle accidents, things along those lines.
So we're not related, I promise you, but I think you're describing me, because when I was younger, I was a nightmare to my family and relative, because I was way too active. And I remember distinctively that I was in front of the class, kneel on my knee, and have to carry a book. This is punishment for active boy, where I came from, almost every day. And I got broken arm, I got scar everywhere to show, and so I remember got a lot of punishment, but I know I grew up with a grandmother who was very patient with me, and she really knew how to calm me and talk me out of jumping into the swimming pool when I didn't know how to swim, or riding my bike on the street. Like, I was the only one on the street, right? Yeah. So a boy is very, very active. But I also want to make sure that we not overly diagnose boy with ADHD, as you point out. I so appreciate that, because I've always heard parents call me and say, I think my boy has ADHD. Can I just go get him seen and get a prescription? And say, well, come. Prescription is not the only thing, right? So there are other behavior modification that you can provide. And certainly information, parents should look into proper information rather than get referral from neighbor. So I know the Orange County American Academy of Pediatrician in Orange County chapter has a lot of information. I would recommend that parents with young boys and young girls utilize information on the website is aap-oc.com. So they have a lot of information. For our first video break tonight, we're going to see 3 short videos that ran in a campaign to support the movement, which aims to establish the stigma associated with mental illness and addiction. Our goal is to create an environment where people feel seen and supported in their effort to achieve wellness and recovery. So let's take a look at those videos.
Don't let people's depression, anxiety, or substance use stop you from seeing them as they truly are. Join the stigma-free OC movement to open your eyes and mind today. How do you look at a person living with mental health, alcohol, or drug problems? Join the stigma-free OC movement to open your eyes and mind today.
The way you view people living with mental illness or addiction says more about you than them. Join the stigma-free OC movement to open your eyes and mind today.
Welcome back. This is Your Health Matter OC. This is Dr. Chow and Dr. CK. We are talking about men's health, physical health, and mental health tonight with our 2 special guests, Dr. Kwan and David Boyajian. So if you have any questions for us, please send us an email at yourhealthmatters@ochca.com. So gentlemen, let's talk about young adults from a primary care perspective. How frequent do you see young men come in and talk about depression?
Well, as a whole, I'd say that it's much more rare than women coming in.
Okay.
I think in general, I think depression, mood disorders, mental illness as a whole, I think perhaps there's even more of a stigma for men. And I think that has to do with just kind of, you know, being macho and having to grit your teeth and just get through it. So I'd say that from a primary care perspective, I see it less, right? Now, certainly there are people who come in, and there are people who come in for other issues, and I think perhaps the underlying issue might be something like depression.
Got it.
You know, I've had men come in and say, you know, I'm just excessively angry. I need anger management. I'm getting angry all the time. And I think, you know, oftentimes I see that could be the manifestation. I mean, more commonly you think of depression, you think, I don't enjoy anything. I don't have pleasure from anything. I feel excessive sadness. I just can't get through my day. But I think with some, and perhaps more commonly with men, you know, depression manifests as anger that's persistent. And so that's been my experience. Again, certainly less, but I think it's there. It's just not coming forth as frequently.
So by the time they come to see you, what do you see, David?
And well, in youth and adolescence, I mean, I'm similar to what Dr. Kwan was saying. A lot of times depression manifests itself for men in terms of anger. There's oftentimes other issues such as anxiety will manifest themselves a little differently. But in terms of depression, yeah, I mean, anger is the main one. And we have typically, you know, you were saying that you don't often see as many men come in for that. When I worked for the Children and Youth Behavioral Health Clinic as an intern, we would see pretty equal number of boys and girls coming into the clinic. And a lot of the men, the boys I worked with would, most of them struggled with anxiety at some level or low self-esteem, which also would lead to some depression as well.
And so what about addiction? So I would assume that many would ended up using substance, right?
Yeah. So a lot of substance use disorders start at a very early age, and I work primarily with adults and with substance use disorders right now, and many of them, I mean, a shocking number of them started using crystal meth at 13, for instance, and I mean, obviously that's a very pivotal developmental age, and the brain is obviously still forming and will form into their 20s, and so it has a drastic impact. Excuse me. It has a drastic impact on their ability to feel healthy, normal feelings and not to be emotionally dysregulated.
So from a primary care perspective, what would you suggest to primary care physician as related to screening?
Well, I mean, I think asking about things like alcohol use. You know, I think the National Institute of Alcohol Abuse and Alcoholism, they have guidelines as to, you know, what would be heavy alcohol use and what's risky alcohol use. And, you know, just speaking to your question, you know, that you directed to David, I mean, I think that substance use is a very common coping mechanism. And so when I see substance use disorders, some sort of chemical dependency, very likely there's an underlying depression, anxiety, you know, perhaps PTSD, you know, history of childhood traumas, all sorts of things. Because, you know, a lot of these things, like alcohol, intrinsically, I wouldn't say it's anything that's bad, and it, you know, elicits euphoric feelings and, you know, sometimes a sense of community and actually can bring people together, right? But, you know, used excessively and in harmful ways, you know, people, I think, oftentimes go down that path for a number of factors, you know, whether it's genetic, environmental, whether it's, you know, prompted by underlying disease. I think that just asking about these things and correlating them to underlying mood disorders is important. That's been my experience.
So how do people access, young men access care through the county if they're facing issue like depressions and addiction?
Mm-hmm. Well, there is the county mental health clinics. There are children and youth behavioral health clinics, and for anyone who is on Medi-Cal, for instance, they can go to any of the 5 locations, I believe, that are spread out throughout North and South Orange County in order to receive an evaluation to see if they qualify for mental health services through us.
But I know early on, Dr. Kwan, you shared that we have a link that you use often in your office. You want to share your experience with that?
Yes. I mean, a wonderful resource here is OC Links. And OC Links is a phone number that a patient can call. It's a 24/7 hotline. When they call it, they get a clinician on the other line. Sometimes I believe it's a therapist, sometimes I believe it's a nurse. But this person is trained to triage patients to an appropriate place to find care. It's hard to navigate healthcare. I mean, it's incredibly difficult. I mean, even if you're you know, you could be uninsured, you could have a Medicaid plan, you could be commercially insured, and it's just hard to know where to go. OC Links is a wonderful phone number that you can just call, and you know, depending on what your need is, the person on the line can tell you, you know, these are the psychiatrists you can see, these are the therapists you might be able to see. This is where you can go to seek treatment for substance use disorder. So yeah, it's a resource I've used quite frequently.
Yeah, thank you. That is the county resource, and it's so nice to hear a professor at UCI also use OC Links. That's fantastic. The other thing that is new to us too, and I want to take this opportunity to share with the community, is that we also have stood up the OC Navigator. So please go online. I think it's on the screen right now that you have access to OC Navigator. There's all sort of resources beside treatment, housings, and other human services that you can locate close to your home. So the next video we're going to share is called Wrong for You. And that's the piece that I hope we can talk about when we come back after this video break. This is a campaign for mental health and recovery services related to the addictive prescription opiates, right? So we've heard the number of people who die from fentanyl has increased in this country dramatically the last few years. And Orange County is not an exception as well. So we want to draw the attention to how important it is to have conversation with your provider in case you need treatment and what is right for you. So please watch this next video.
This is one of those pharmaceutical commercials where you see strong and confident men in slow motion. With a smile, because they're happy that prescription opioids took away their pain.
But then they took more.
Like my relationships, self-esteem,
And ability to stop taking them. Yes, anyone can become dependent on prescription painkillers. Like me.
or you.
There are other ways to control pain.
So ask your doctor if opioids are wrong for you.
If you're like us, they are.
Welcome back to the topic of physical and mental health tonight with Dr. Kwan and David Boyajian. We'll get it.
Oh, great.
Flows smoothly. Okay. And Dr. CK. I know we have been talking about a fentanyl death in this county from a health officer perspective. Give us your thought.
I think it's dangerous. I think, unfortunately, fentanyl can be laced in many different medications and many different illicit drugs or recreational drugs. So when someone is now maybe wanting to get marijuana off the street, they really don't know if it may be laced with fentanyl, and it only takes a very small amount that you can't even detect that can actually lead to death. And then also I know that there's a lot of younger adults who may be experimenting with drugs, and again, there's that chance of that it can be laced with fentanyl. Our law enforcement, unfortunately, has been dealing with a lot of fentanyl-related incidents, and it's really a problem. Sometimes, you know, the drugs come from below or south of Orange County, and then goes to Orange County, and then goes into east and north of us, and unfortunately, we're catching it. Or good news is law enforcement is catching some of it, but not all of it.
But what you just said is really important, and that is people don't know what they bought actually been laced with fentanyl.
Right.
That's the danger of it, right? And so we have so many, I'll label it accidental death, is because they didn't have intention to use fentanyl, but they bought stuff that you know have fentanyl in it, and so then they got themselves in a situation where you know it's lethal.
And this is where I think it's really important for everybody to learn how to use Narcan.
Great.
Narcan is a medication that you can get over the counter. It's nasal, so you don't have to be a health professional to know how to use it.
And you don't need a prescription.
Correct.
So you can go into a pharmacy and get Narcan. And please, if you have family member whom you suspect that are doing drugs, illicit drugs, please go get yourself Narcan and have it on hand in case they need it. Okay?
And even if you have a family member who is taking pain medications, or if you're a person who is taking pain medication, you should get Narcan also, because you never know that medication may get in the wrong hands.
Yep.
Or unfortunately, a family member may overdose, and maybe they took too many pills. Narcan can reverse that, but it needs to be administered immediately as you're waiting for help to come.
Yep. So now let's go to mid-older adults, gentlemen. I know mid-older adults, the thing that we worry about the most is prostate cancer. Mm-hmm. So can you talk a little bit about that, Dr. Kwan?
Sure. So, you know, it's a complicated subject. I think that prostate cancer screening is something that should always be discussed. It should be considered, it should be discussed. I don't think it's something that's reflexive. You shouldn't go to the doctor and just have it ordered.
Okay.
And if it's just ordered, perhaps you should say, hey doc, can we talk about this? And the reason is that you have to consider the risks and the benefits of getting prostate cancer screening. You know, there is a high false positive rate. There are complications that you can suffer from obtaining a biopsy if you have a positive PSA. There are complications that you can have from having surgery or treatment for prostate cancer, which may not have actually killed you. And so it's not just a very simple, you know, topic. I think the guidelines for this have changed again and again and again. And you know, I know that right now the United States Preventive Service Task Force recommends that you consider screening between the ages of 55 to 69. And this is with a discussion, of the risk of, harm as well as benefit. And then other societies like the American Cancer Society, recommend that you start considering this at age 50, perhaps even younger if you're at higher risk. Generally, when we talk about higher risk, we're talking about usually African American men with first-degree relatives who've had prostate cancer before the age of 65. That's what kind of gets you into that screen at 45 or 40 sort of category. But certainly it's not, just a thing that you walk in and, it's just a test to get. It's something that you should really think about and talk to your doctor about.
Thank you. So another condition that we know from statistics in this county, and it affects certain age and certain cultural group, and that is suicide. So we do know that one of the 3 groups that have a higher risk of suicide in Orange County is middle men, and particularly middle white men, right? So what do you see in the clinic, David?
Yeah. Well, I mean, there's a loss of meaning and purpose for some of these individuals, and you find that a lot of men typically put a lot more emphasis or part of their identity in their work, and they isolate more easily. And so this is just a common trend you see across, especially as men get older, they become more dependent on their relationships with their friends at work. They become a little bit less dependent on relationships outside of their work. And if they don't have a lot of pro-social connections, then they are at more risk of suicide. So I think particularly for Caucasian men, I don't know the specifics per se, but I do understand that I think there are Caucasian men who do maybe feel that they don't have as much of a place in society probably for various reasons, right? So that could be influencing it as well.
So older men probably tend to have a lot more pain as related to bodily pain. Can you talk a little bit more about that, Dr. Pran?
Yeah, sure. It's an unvirtuous cycle. I think that it doesn't matter if you're older or not. If you have a lot of pain, oftentimes that predisposes you to feeling depressed.
Okay.
And so, and I think that when you have depression, I think you feel pain more acutely. And when you have pain, that kind of promotes feelings of depression. And so I think that, as a physician, I need to stay vigilant to symptoms like headaches, dizziness, back pain, muscle ache, just countless somatic symptoms, that don't have like a very clear etiology a lot of times. But I think that a lot of these symptoms are brought on and made worse by underlying depression. And I think that as you get older, depression may manifest more in those sorts of symptoms. It may be that you just have more of a loss of sleep, or you're losing weight, or something like that, as opposed to explicitly saying, I feel so sad and hopeless about something. Does that answer your question?
Yeah, I think from a primary care, and certainly both of you are primary care physicians, from a primary care physician experience, what are some of the red flags when you have men keep coming in and asking for pain medications, and what is your typical recommendation?
So it's actually more than pain. Just like we learned earlier, men have that machismo about them that they don't go to the provider or their clinician for anything. So when a male finally enters the clinic, I've got to already have my radar on. I've got to understand, okay, what is this patient asking for? And let me see if I can kind of go around the original reason for the visit, because there might be a lot more to just, my wrist hurts or my ankle hurts. Likely there's some other underlying issue that brought them in. Because again, I see this a lot. Men come in with that machismo, I can take care of myself, I don't need a doctor. So again, when they come in, for any reason, I take them very seriously, and I try to like cover as much as I can in that visit to get to the bottom of it. I don't always get there, but example, early on in my career, when I was at Barstow, there was unfortunately a patient who kept coming in and seeing my corpsman for other reasons, headache, or there, I think, some nasal congestion. Every week, and had I seen it, like we were busy clinic, and had I seen the pattern that this person came in consistently, hopefully I could have intervened. Unfortunately, this person committed suicide, and it was a call for help. Every single week he was coming in for some symptom, for sick call, because it was a call for help. He was wanting to hurt himself and not coming in for depression, but for other reasons. And again, from the healthcare perspective, especially those of you who are out there seeing patients, please have your flag up when you're seeing a male come in, because again, they can be coming in for another reason. But pain can come in. They can come in for pain, or just like Dr. Kwan said, it's a sign of somatization. And it's not to dismiss their pain, they're in pain. But depression, anxiety worsen the pain.
So from a primary care physician perspective, how often do you actually screen and ask about suicide in older men if they keep coming in with complaints of various types? Obviously, pain is one of them, right? How often do you think primary care physicians do it or should do it?
You know, how often do we do it, and how often should we do it? I mean, I think those are definitely both very important questions. You know, I'd say that we do screen with basic inventories for depression, right? And these are very, very basic tools. And if they're positive, and they're just 1 or 2 question tools, then we do a little bit more of a detailed inventory. And in that inventory, we think, you know, we talk about, you know, do you have thoughts of harming yourself, or do you feel like you'd be better off if you never woke up in the morning? Things along those lines. But, you know, across the board, are we asking that question? Not in my practice. Should we do it? Perhaps. You know, I think it's a question to be considered with data. But certainly if there's certain positives with certain screens, then I will definitely ask. And particularly if they're on medications for mood disorder already, depression, you know, anxiety, or if they're being treated for pain, certainly.
If they share with you, right?
Mm-hmm.
I mean, I know when I was in the clinic seeing patients, it wasn't a surprise to me that sometimes I asked male patient, hey, do your primary care physician aware that you're seeing me, or are you taking medication? And shocking that they said no, right? So I had to be very, very assertive, I wouldn't say aggressive, assertive in demanding that I really need to talk to your primary care physician, because we need to work as a team, right?
Yes.
And so I think that's the problem with our healthcare system in this country, is that specialists are so silos from the primary care physician.
Yeah.
And certainly, I mean, there's an obvious shortage of mental health professionals, including psychiatrists and therapists, behavioral health clinicians like David. So it's not easy for a primary care physician like you to say, well, just go see a therapist, just go see a psychiatrist, and it's readily available. So that's a separate issue. But the other issue is you each has very short time to deal with patient, right? And so how do you assess? And I know there's a lot of primary care physicians afraid to open that can of worms, because if you open it, you now going to have to spend more time with the patient, and you're running late and your schedule is packed up. So I'm a very big proponent of integrated medicine, where folks are working together. Let us go to another video break, right? So this video is an encouragement for everyone to wear blue this Friday, because this Friday, June 17, is Men's Mental Health Day. So we're going to come back and talk to David more about that. A day in which everyone is encouraged to wear blue to increase awareness of mental health crisis that we have in this country. So please take a look. welcome back to Your Health Matters, OC. Yeah, we just showed you that this Friday we encourage you to wear blue, but I think this whole week we should wear blue, right? I'm wearing blue. You have blue shoulder photos now. I think we need to pay much more attention to men's health. I think that's the area that we don't do a very good job as a whole health system, particularly when we talk about elderly men who's struggling with either pain from, as you age, your body just breaks down, right? And if men are a little bit rougher, the stereotype starting out as a young age, we're a bit more physical and a bit more active, then your body wear out very quickly. And then coupled with the issue of not wanting to share the feeling, right? If you are struggling with pain, and that easily could cause you to have depression, or on top of depression, you have pain is worsening the depression. And we talk about suicide before the video break. What do you see when in your clinic, David, when men come in, elderly men? We just talk about how primary care setting have so limited time to see patient. How do we screen on the mental health, or is that because they came into the system and we don't screen?
Yeah, I mean, if they came into the system, I mean, I'm going to do a general mental health status exam, and that includes looking at someone's level of sleep, how much sleep are they getting, how's their appetite, what are they feeling throughout the week. There's various other questions that are asked, and in terms of looking at depression, for instance, I'm looking also even at their levels of interest. Have their levels of interest in doing daily activities or fun activities, has that increased or decreased? Is there guilt? Do they feel guilt? Do they feel a lot of internalized shame? Or how are their energy levels? How is their concentration? How is their appetite? How is their psychomotor movements? Do they have muscle movements that they can't control? And then also, do they have suicidality? Do they have, in other words, thoughts of suicide or suicidal ideation, which is kind of a passive suicidal thought, not an actual desire to commit suicide? But I mean, the screening we would do for those older adults and the elderly would be the same. But I would also include in there too, what is their social connection? Like I was going back to what I talked about earlier is, as men tend to get older, they become more isolated, and they do neglect their health, like you were saying, more so than women, typically speaking. Partly because of like Dr. CK was saying, it's of a machismo, or just the idea that men need to be tough, men can't be weak, right? Men can't cry, men can only have two emotions, either happy or sad, or I mean happy or angry, sorry, right? Sadness is not allowed, right? Yeah, that's what we would typically do.
So thank you for that. I mean, I think you kind of inevitably train our audience. If you live with somebody who, well, an elderly man, these are the kind of stuff that you want to pay attention to, right? Their level of activity, their level of interest, if there any change in it, appetites, and what have you. So those are good things to know that you need to really contact your healthcare provider and share, because we know men, we don't usually go to our doctor like Dr. Kwan and Dr. CK and then just spill it out, right? Everything is fine, everything is normal.
Anytime though, if you'd like.
I'm one of them, right? Everything is fine, right? So we need to really be open and be aware. One of the other statistics, though, we know that when men die from suicide, the lethality of it is usually, the mean is usually gun, right? And so for those family out there that have gun, please consider safely lock up your gun, right? You can find a lot of information on how to safely store your gun, because that is very important. Because we do know that people, particularly men, who die from gun inflicted wound is because there's access to gun at home. Yeah, just please be careful if you own gun at home. to really consider that. Is that something that you talk to your patient, for both of you, primary care physician, Dr. Kwan and Dr. CK?
Gun safety?
Yeah.
Yes, absolutely. Yeah, and I think that, you know, there are questionnaires that we administer where we ask patients, you know, do you have a gun at home? Do you keep a gun at home? And a lot of times, you know, this affects these young boys that we started off this segment on, you know. I mean, I think that they're curious, and guns are very, very, you know, shiny, powerful, cool sorts of things that you might see on TV, and you can go play with a gun. And so, yeah, I think it's very important that guns be locked up, and, you know, if we know that a patient is a gun owner, we'll advise them, or not even advise them, just ask them, hey, do you have a safe at home? Do you keep it safely stored?
So I know for the remaining 7 minutes or so, I want to get to some of the questions that the audience have sent in to us. This one is from Mark. Thank you, Mark, for sending in the question. I have just hit 40 and I feel like nothing in my body works the way it used to, just 1 or 2 short years ago. What advice do you have for me to keep in shape and find my way back to my previous energy level? I think that one is for you, Dr. Kwan.
Oh man, I think it's all pretty basic stuff. A lot of this stuff, you know, it's you know, are you getting exercise? Are you sleeping?
Good.
Are you in community with people? You know, are you isolating? There is going to be a natural sort of decrease or deterioration in terms of your physical abilities. I think that with each year that passes, I experience one more joint that hurts as well. So I'm right there with you. But, you know, I think that, you know, that's where you can start. You know, if you haven't seen a doctor, it might be good to go and get a physical so that you can just have a good idea of where you might stand. You know, at the age of 40, you know, depending on what you have going on, you know, I might check some labs, you know, check you for high cholesterol, check your blood pressure, screen you for depression, you know, see what you're doing with substance use. You know, all of this matters.
And I would check for sleep apnea. Because sleep apnea starts to settle in, and then people get tired because they don't realize they're not really getting good quality sleep because they're having sleep apnea.
Great. Yeah. I think this one's for you, David, from Andrew. This past year has been an incredibly difficult and disappointing one for me. So many plans fell through or never materialized. I ended a long-term relationship and I had to change jobs. I'm feeling lost, a little angry, and at times a bit hopelessness. Do you have services that you can recommend that are free or low cost to help me combat this issue?
Great question, Andrew. So I would say, one, I don't know what insurance you have, but if you were on Medi-Cal, for instance, you could get screened by the county for that. And there are resources. The OC Links is a great resource to start that process. If you don't have Medi-Cal, for instance, there are lots of community clinics around, actually. A lot of the major cities in Orange County have very low-cost counseling services. Even the Brea Community Center has low-cost counseling for individuals, couples, families, children. There's many nonprofits and other agencies that offer mental health. I would just say you could also contact, I believe it's the 411. Am I saying that number right? A resource for finding other. It's a number you can call for other resources as well.
It's 211.
211. I'm sorry.
211, yeah. But I would say, if you are really in need now, you can just call OC Links, and somebody would assess you and see if you qualify for services, and certainly if you're not qualified for county services, because we have some mandate on who we serve. Certainly the folks that meant the OC Links phone line will be able to refer you to the resources that David just mentioned earlier. And so please, I know the screen just showed you the number to OC Links. Please give them a call. Thank you.
Anything thing I want to mention for anyone who's feeling that they're kind of lost in the medical system or waiting to get care.
Yeah.
There's so many other resources in your community that you can tap into that maybe not relate to healthcare, but they also serve almost as social workers. So if you had a previous religion or religious background, that's also a resource. In the military, we used it a lot. We had different pastors who really helped people spiritually, because sometimes it's just, where do you belong in the world? And that's a question that sometimes comes down to spirituality. So that's just another resource to consider.
Okay. Here's a question from Chase. I am in my late 20s and experienced COVID last year around January. Since then, my sex drive has been affected, and I am not sure if it is a result of COVID or not. Could that be the reason? What should I do to get my drive back?
So we're still learning a lot more about COVID. We know that COVID does affect nerves and vessels. It may or may not be associated. It can also be related to depression. So the first and foremost, see your primary care provider to have that discussion, to assess for other etiology. And in the long run, hopefully we'll learn more about COVID and see if we can find treatments. But I would start there.
Yeah. And certainly we now know the statistic went from 1 in 5 and in 4 to now perhaps 1 in 3 people who've been tested positive for COVID with various either symptomatic or not have had what we call long COVID syndrome. And part of that is anxiety, depressions, and certainly, as Dr. CK mentioned, we don't know the effect of that on other organ systems, because we do know that the coronavirus actually create inflammations all over your body, right? So you really need to see a physician and get it checked out, Chase. Okay. Last question from Caleb. As a 30-something, I'm not sure what the best physical and nutritional options are for this decade of my life. I'm looking at you, Dr. Kwan. Are there things I should be doing that will help prevent health issues down the line? Are there foods that are best for me? Do you have general advice on any vitamins I should be taking? I think a lot of young men are asking this question.
Yeah, and I think that what I'll say is that if you're worried about weight, if you're worried about health, if you pick a fad diet, it'll work, okay? So you could do it by your blood type, you could pick paleo, you could do anything. But the question for me oftentimes is this something that's sustainable, right? And frankly, a lot of these diets, they just aren't. If you're gonna completely cut out carbohydrates, you will lose a lot of weight, and you'll lose it very quickly. But do I see most patients, as in almost all of them, kind of rebound? Yes, absolutely. So in terms of diet, I think that a couple that have been proven, the Mediterranean diet, the DASH diet, one that's higher in fruits and vegetables, lean meats, nuts. I think just trying to eat healthier that way, in general, and doing it in a sustainable way is the most important thing. In terms of vitamins, I'm not a huge proponent of vitamins. I think that if you want to take a multivitamin, I'm okay with it. I don't discourage patients, but I do encourage them to try to get those nutrients from fruits and vegetables. I think that's the best source.
So eat a well-rounded diet and exercise regularly.
Yeah.
That's your recommendation, right?
Yeah, and I generally recommend about 30 minutes of exercise, per day, at least 5 days a week or so.
Yeah. Hey, I noticed that you're wearing a pink ribbon. Pink. What is that?
So, we started off earlier this year talking about women's health, and now we're in men's health. And unfortunately, I became part of the statistic. I became the 1 in 8 women who is diagnosed with breast cancer. And so I'm wearing pink to support all those women out there who are doing breast cancer. And I'm now on my journey to try to get treatment. So I actually will take some time away from work to take care of myself and my health to address my recent diagnosis of breast cancer. So I want to say thank you to all of those who have been supporting me throughout this journey. It's been a wild ride. And want to say, I want to encourage those who are in this journey and new to this journey to really seek help, get your support from your family and your neighbors and even your coworkers, but really take care of yourself. And this is where it's so important for all of us no matter your gender, no matter your race, no matter your background, get the care you need. Go to routine screening to make sure you can take care of yourself and get ahead of any cancer or any condition.
Thank you for sharing that. I just want to let you know that that's so brave to share with the public. It's your decision, but we're rooting for you. We're here for you, and you let us know how you want the public to be updated. Okay.
I'll probably provide updates, and hopefully some pictures of me surviving this and battling this.
Yeah, thank you. And so I think this is a good way to encourage our women to screen, our men to screen or get regular checkup. I have to tell you, I had a case today where the person told me that she's not been seen by a physician for 3 years, and I almost fell off my chair and dropped the phone when I heard that, right? So please, you really need to establish a primary care physician who follow you and give you advice on what you need and screen you appropriately, whether or not you're men and women. But thank you so much.
Thank you.
With that, I want to thank our guest speaker today. Gentlemen, we can talk about this all day. Maybe we need to invite you back to have a more in-depth conversation on other conditions that men, especially elderly men, face. There's so much we want to talk about, but we only have an hour to do this. So promise me you're going to come back. Please thank Dr. Kwan and David for me. With that, I want to let you know that in 2 weeks, on Tuesday, the 28th, our next show, we're going to be honoring the LGBTQ community who are celebrating Pride this month. Hence, you see the mask. And so we're going to be talking about a health issue related to this community. So please tune in. Between now and then, you can always send us questions to yourhealthmatters@ochca.com. Again, the question can be sent to yourhealthmatters@ochca.com. So see you in 2 weeks. Until then, be well. Thank you.